Welcome back. They say it's harder to lose weight as you get older. Our next guest asked the question why, then set out to correct the problem. In many cases, it's because our hormones are off, and that can slow down our metabolism, among other things. Welcome back, Dr. Shalina Laji, director of Dr. Shel Wellness and Medical Spa, with some solutions on how to look and feel your best going into the new year. Also joining us is her patient, Ginger Hutter. Hi there.
Ginger. Hello, Deborah.
Okay. Ginger, you had gone into this thing that we call mid-age, middle age,
Yes.
right? And you started noticing some changes.
Some serious changes. I was completely exhausted, tired all the time, mood flashes, mood swings, hot flashes, had no energy, couldn't sleep at night.
Yeah.
And didn't really know what was wrong with me. I knew I was hormonal deficient for about 12 years after having a hysterectomy.
Right, right. And so what had other doctors told you?
Oh, I had a little chemical or hormonal imbalance, but they patched me with antidepressants or other medications.
So treated the symptoms, but not really the problem, which is
Correct.
we're now, starting to see a lot of doctors, Dr. Shel, say, you know what, wait a minute, that's not the way we should practice medicine.
Right. We need to figure out what's actually causing the symptoms that you're experiencing. So there is a reason why the body is experiencing the hot flashes, the weight gain, the fatigue, the lack of energy, the mood swings, the lack in sex drive, which is really, really important for, all those symptoms are really important for us to lead a very productive and happy, healthy life.
Yeah. Now, she had the hysterectomy, so we understand why she had a hormonal imbalance, but the rest of us go through that as well with just aging.
Yes, we do. It's aging, and what happens with age is, of course, all the hormones that are so important to us start declining, such as your estrogen, progesterone, testosterone, DHEA, thyroid, your adrenal hormones, your cortisol, and we don't realize, but all of those hormones are essential for us to feel very, very healthy and happy and lead a productive life.
Yeah.
So it's really important to get to the core of the issue, as well as your nutrients. Your nutritional balance is very important, as you know, Deborah, because, we try to eat as healthy as possible, but the foods just don't have the same nutrients they used to have. So it's really a combination, and once we fix that, voila.
You figure out what the body is lacking.
Yes.
Okay, so when a patient comes in, like she did, what do?
The first thing I do is I spend about an hour with my patients to really get to know who they are, where they've been, what they're experiencing, what their symptoms are. And I'll be honest with you, when I was practicing as a gynecologist for many, many years accepting insurance, there's no way I could spend an hour with my patients.
Right.
So now that makes a big difference to the patients. But then we do a baseline hormonal study to see where they are.
Yeah, okay, and so there's that test that other people say, well, I went to my doctor and they said that wasn't the problem.
That's right.
Explain to us the difference between how you read that test in combination with listening to somebody's symptoms.
Very important question, Deborah. The way that you read it, and I'll just give you an example, thyroid, for example. The range of the thyroid result is about this wide, when it really needs to be optimal about this wide.
Right. So basically, if the range is like this, and you were here, and now all of a sudden you're here, like what happened to me after having my son.
Yes.
I was a crazy woman.
You were.
And she can tell you. No, but and because it was all the things that you talked about, depression and all that type of stuff, tired, and so your body notices when there's a shift.
Yes, it does.
That range is way too wide.
That's right, and you're still within that range. So most traditional doctors will say, well, you're still within the range. So it's not your thyroid.
You want some antidepressants,
here's an antidepressant. Exactly. And what we do is we know where the optimal range is, where you, Deborah, needs to be. And we look at that, as well as look at the ranges for your estrogen, progesterone, testosterone, etc. So when libido starts going down, when hot flashes start coming up, you know that there are deficiencies, and we can easily correct them by giving you the natural hormones that are biologically identical to what your bodies are used to recognizing.
Right. I want to talk a little bit more about bioidentical in a second, but what happened when you started, because you had taken synthetic before, and it just wasn't quite cutting it for you?
No, and I was concerned about the side effects, so I got off of them completely and just really needed to do something. I was on a downward spiral with exhaustion.
You couldn't get out of bed?
No, I was in bed for 3 days out of a week.
Wow.
And it was part of stress, but it was mainly hormones.
Yeah, and so when that was all changed and you used the bioidentical and got it all balanced and figured out what you were missing, how did your life change?
I can get out of bed. I'm not dragging to get out of bed. I'm sleeping at night. I'm more focused. My children think I'm still on antidepressants when I'm not.
Yeah.
I'm much calmer, and I have my hot flashes are dwindled to nothing, and so are my mood swings, and I feel so much better.
Yeah.
And I know that I have a ways to go with some other things that I want to take care of, but she's helped me get my life back and get focused again in order to be able to be productive.
So as our body changes, you can help us change with it.
Absolutely.
Whether you're going through menopause, whether it's just like we talked about, just aging, or many times after a woman's had a baby, that the thyroid can change.
Yes.
All right, bioidentical. How's that different from natural and synthetic?
It's very different from synthetic. Bioidentical, the simple definition is it's biologically identical to the hormones that we produce in our entire lives.
Your body has no idea it's not its own.
Exactly. The body recognizes it, it has the receptors for it, and so it processes it. Thus, the side effects are there's none, because you've got your own hormones coming back into your bodies, and so your energy level's high, your sex drive's high, your mood swings are gone. You just feel
everything's back to when you were in your 20s.
That's right. You feel
and with natural, your body, like even if it's like pig or something like that, your body can use it because it's similar, but it doesn't necessarily like it.
Exactly, and it doesn't know what to do with it, so it does cause side effects.
All right.
Yes.
Ladies, thank you very, very much.
Thank you.
Dr. Shel has a holiday preview party on December 8th from 9 a.m. to 7 p.m. And at that preview party, you can ask questions and you can talk to them, personally about what you're going through. You can also, this is the good part, you can also get 30% off all services if you attend. For more information on Dr. Shel Wellness and Medical Spa, call 281-313-SHEL. 281-313-SHEL, or log on to drshel.com, and that's Dr. S-H-E-L, right?
That's correct. And Deborah, the first 25 callers today will be receiving $500 off any of the services we provide. And that's our holiday giveaway for the first 25 callers.
On your weight loss package, which one thing we didn't get a chance to talk about was HCL, which
HCG
is
diet.
HCG.
Exactly. That's the big weight loss package where you can lose 20 to 25 pounds in a month and do it in a healthy, medically healthy way, and we can talk all about it. If you're interested, just call or come by the holiday preview party.
All right. Thank you very much.
Great.
We'll be right back.
Okay.